we are being hosted by Derek Otabil from Ghana. So you are getting us from Nairobi in Kenya. That is where you're getting us from. And we ask you to just give us a few minutes. We'll be able to discuss with you on this subject, and then we'll allow you just a few minutes to also respond to any questions that you may be having. So, welcome on board. Good morning, good afternoon for some of us who are probably away from Ghana. Um, in this session, I will be telling you about who we are at as Randqual Consulting Group. I will be introducing to us healthcare quality. We'll discuss about 15189 as an introduction. We will then talk about the value of ISO 15189 accreditation. We'll also talk about the process, what is involved in this process of getting to accreditation. And then later on, we'll have a few minutes to answer to any questions that you may be having on this subject. Now, for those probably who have not had an opportunity to interact with us, we are a training and consultancy firm focusing on quality management systems and also occupational safety and health, particularly for healthcare organizations. We have been doing this for the last 5 years now, and that is from 2021. And our offices are located about 20 kilometers from Nairobi, Kenya. And for those who probably may not know, Nairobi is on the East African side of our continent, and we are right on the Nairobi Thika Superhighway on exit 13. So, as a training and consultancy firm, we are duly registered by the National Industrial Training Authority of Kenya. This is the body that registers all organizations and individuals who partake or who participate in trainings for continuous professional development. We are also an approved CPD provider or continuous professional development provider, registered by the Kenya Medical Laboratory Technicians and Technologists Board here in Kenya. We also work closely with the African Society for Laboratory Medicine, where we do trainings for them on various subjects in laboratory and allied sectors like proficiency testing and also calibration laboratories. And we also work closely with the Kenya Accreditation Service, which is the sole accreditation body here in the country. And I believe they also do a number of accreditation assessments in Ghana. Like it has been said, I also assess with the Kenya Accreditation Service as a technical assessor for ISO 15189 and also ISO 17043 for EQA and PT providers. Now, just briefly on what we do and who we are. Or like I mentioned, our core mandate is trainings and consultancies. And so we do a lot in terms of quality management systems trainings in all areas of healthcare, from laboratories to the entire hospitals. We do support for those organizations that are pursuing accreditation. That is the accreditation or certification consultancy. We also have a software for quality management system, and we also have another software for EQA and PT. Now, besides those trainings, we also do supplies for hospitals and laboratories and all that, and we also do laboratory business development support for any organization that is looking to advance or to ensure sustainability of their business. Now, that's just our calendar for the year. We have a number of trainings that we have scheduled for the year. And what you have seen is just a number of trainings from April all the way to the end of the year. My colleague Anne will be sharing probably the same poster and also the registration link, just in case you'd like to join us for that. But let us now get to the business of the day. And I want to begin by introducing healthcare quality because we are doing ISO accreditation so that we're able to deliver quality in terms of service delivery to our clients. Anytime our clients come to seek services, anytime they come, to get that laboratory test, they're looking for a service they can trust. They're looking for a service that is credible. They're looking for a service that will assure that how the patient is going to be managed, there's not going to be any errors. And so when you look at ISO, among other standards, quality is defined as that degree to which a set of inherent characteristics of a product or a service fulfills requirements. Our focus every day when we get to the lab is to ensure that the service we offer as a laboratory department, the product we release as a laboratory department, for instance, the blood pints that we give for transfusion, they meet all the requirements, either specified by the regulatory bodies in our country or prescribed by different international standards. Now, quality of care, according to WHO, is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes. That when a client visits our laboratory, they desire to get well, they desire to get the results that will tell exactly what is ailing them. And so, if our service delivery is able to provide that, then our service can be described as quality care. Now, very briefly, you've heard about the domains or the dimensions of healthcare quality, or probably the definitions. When someone talks about healthcare quality, what are they talking about? WHO and also the Institute of Medicine describes healthcare quality as a service that is effective. And so effectiveness is one of the domain of healthcare quality, in that whatever service we deliver as a laboratory achieves the intended purpose by this client or this laboratory user. That if a healthcare service is going to be described as one that has met the quality standards, also has to be patient-centered, that all we do in our laboratories must focus on the patient. How is the patient going to get better because of the service that we are offering? It is not just about getting accredited. It's not just about, saying and displaying that we have achieved these international standards, but it is what the client will say about the service that we are offering. Timeliness is another, in the sense that no one wants to wait the whole day, for that laboratory service. They want to be served as quickly as possible. And so accreditation will help us to deliver these domains that we are talking about in terms of timeliness, efficiency, equity, as well as patient safety as well. So these are some of the domains, some of the definitions that we can always talk about when we are referring to healthcare quality service delivery. Now, ISO 9001 puts out 7 principles of quality management. I believe some of us may have heard about this. That if you're talking about a quality service, or if you're talking about quality management, or ensuring that our clients receive what they desire or receive services that meet the requirements, then customer focus has to be one of the principles that we must have in mind. It is not about just meeting some requirements and showing some documentation, certificates, and communicating online of how well we have established our systems. It's about how our client appreciates the service that we are delivering. And so customer focus has to be a crucial consideration when we are establishing a quality management system. And that's why many laboratories will engage in feedback, seeking for feedback to know what the clients are saying, what they want, what we are not doing so well, so that we can be able to improve on it. Now, accreditation will help us in ensuring that everything we do is customer centric. Now, leadership is another quality management principle that is so crucial because if you don't have someone who is leading the process, it means you are going to get it wrong. It means that we not have, the sense of direction of where we are headed. And so we need the quality objectives, quality policy, quality direction. And this can only be provided once we have someone who is leading us in this process. So this could be the quality manager, it could be the quality champions across the different sections of the lab, and so on and so forth. Now, engagement of people is also crucial. I know many of us may have attempted to establish a QMS, and many times we find it difficult, to navigate because our our staff probably will show some sense of resistance because maybe we didn't engage them as at the earliest opportunity, and so they feel left out. When the colleagues feel left out, then that system will have a lot of difficulties to be established and to be able to deliver the services that you desire. Process approach is another crucial principle when it comes to QMS, because like we know QMS, is providing a documented framework of how things are done, so that it will not be dependent on the person on the shift that day. It will not be dependent on who is on job today. It will be dependent on our structure or our framework or our way of doing things. And so a QMS must be able to establish a process of how things are done. Improvement is another crucial principle because we don't want to, stay in one level all the time. Yes, we have the SOPs, but these SOPs have to be continually made better so that we're able to deliver the quality that is also able to catch up with the dynamics of the healthcare service delivery that we are having. Evidence-based decision making, in that we need data for any quality management decision, whether it's an improvement that you want to do, what is wrong with the current situation. So you have to provide evidence of what is wrong so that you can be able to prove to people who need to approve your decision with the data that will really support you. Relationship management, we are not able to deliver quality on our own as a lab. If we have to deliver quality, then we have to be assisted or supported by other departments, from the nurses who sometimes will do sample collection in the wards. We will need the clinicians to also support us so that they're able to, request the relevant tests. We need a good relationship with our suppliers. We need a good relationship with everybody, the government and all the other stakeholders who play a role in laboratory testing. And so the quality officer, the laboratory manager, or someone probably by the name of a liaison officer will help us establish that good working relationship so that we're able to deliver the quality that is desired by our clients. Now, let me go straight ahead to ISO 15189 2022. And maybe, Derek, you can help me know, am I audible enough before I proceed?
Yeah. Oh, you're loud and clear. You could go ahead.
Thank you. Thank you very much. Now, an introduction to what ISO 15189 is. Many of us have heard about ISO, and every country you go, they will tell you, I've heard about ISO, but I don't know who are these people. Now, ISO in full is the International Organization for Standardization. It's a global federation of all national standard bodies that are they're based in Switzerland, in a city called Geneva. And their role is to come up with standards or to come up with internationally acceptable guidelines to help us produce products or services or provide those services or goods in a way that can be acceptable from one part of the world to another. So their intention is to promote standardization of activities in the world with a view to facilitate the international exchange of goods and services. Now, laboratory testing is one of those services that must be standardized because today you're being tested in one of your labs, within Ghana, and you'll probably get further assistance in terms of medical care in another part of the world. And so those people, those clinicians on the other side of the world would want to know now that you came carrying these results saying that you have been tested, you have been confirmed to have this cancer, how will they be able to trust that report? So that's why laboratory testing needs to be standardized in a way that the results you release in your facility can be acceptable across the world. The result you release in smaller towns within Ghana can be acceptable, within the city when you go to seek for medical services. So ISO, by as late as yesterday, they had published over 26,000 international standards, and they revolve around all sectors that you might know from technology, healthcare, manufacturing, and others. And they have about 176 members. And when you hear of members, these are member states. And so far, they have about 834 committees because ISO is a huge organization. It is not possible to have all those professionals, coming together to discuss one standard. So how they work is that they have different committees or different subcommittees to work on specific standards. For instance, the committee that works on ISO 15189 and other medical laboratory related standards is called committee number 212. It is the one that works on anything to do with medical laboratories. Now, you'll never hear that ISO has come to Ghana. You'll never hear them in Accra, coming to check how the different laboratories are doing. And so what they do is that they give these mandates of checking how the laboratories are doing and accrediting them to organizations that they call accreditation bodies. And different countries across Africa have different accreditation bodies. We have about 14, I think 14 to 16 accreditation bodies across Africa. We have some countries that have their own bodies, like yourself, the Ghana Accreditation Service. When you come to Kenya, we also have our own Kenya Accreditation Service. South Africa, they also have it. Nigeria, they also have their own. But because also running and maintaining an accreditation body can be quite a task, different economic blocks within the continent have also been able to establish their own accreditation bodies. For instance, you are aware about the West African accreditation system. It is a body, within the ECOWAS regional economic bloc. And when you go to southern part of Africa, there's also SADCAS, which then is an accreditation body under the SADC or the Southern African Development Committee. Now, when you go to different parts of the world, you will hear of different accreditation bodies. You might have heard about the College of American Pathologists. You might have heard about the A2LA, also an American accreditation body. When you go to the UK, you've heard about the UCAS, the United Kingdom Accreditation Service, and there's also an American body called the International Accreditation Service. So these are the bodies then who will come and do the work of checking whether different organizations are compliant with the different ISO standards. I know gas has not been there for so long, and probably you'll be telling me also how it has been without gas, and now that you have gas, what is the difference? Have things changed, or are we still in the same place that we were before? Now, all these accreditation bodies fall under one umbrella body. Initially, it was ILAC and IAF. So, ILAC is the International Accreditation, Laboratory Accreditation Corporation, which was more concerned with technical standards like 15189, 17025, 17043, those standards that are sector specific. While IAF, which is the International Accreditation Forum, was more interested in non-technical standards. For instance, ISO 9001. So if you are an accreditation body that accredits organization based on a technical standard, for instance, 9001, 14001, and such, which are not necessarily sector specific, then all those bodies were in that association called the IAF. But starting January of this year, these two bodies have been merged. And in fact, they are doing the formal launch today. I think they have started the first meeting at 11, and they'll be having another one at 8 p.m. East African time. So that's probably 3 hours behind or ahead of you. So from today, probably you will stop hearing so much about ILAC and hear more about the Global Accreditation Corporation. So they haven't launched their formal logo and the brand colors, but probably from today you'll be able to see this once they have done that global launch for this Global Accreditation Corporation Incorporation. Now, but because we still have ILAC, when I went to their website, they have some statistics of some of the labs that they have been able to accredit up to around 2024. So they still don't have records for 2025 and 2026. But by the end of 2024, they were indicating that there were over about 12,000 accredited medical laboratories across the world and about 950 in Africa. And almost half of that number of accredited laboratories in Africa is in South Africa as a country. So because they have over 400 accredited laboratories, Kenya, we have about 106. Our neighbors have, you see, 84, 60. Nigeria, they are around 11. Ghana, from my investigation online, I was able to get about 6 laboratories that are accredited. And then your neighbors have 4 and 3 in that order. So that is just an estimate of how many laboratories we have that are accredited across the world and also across Africa and in some specific African countries. So in the entire Africa, probably we are now at around 1,000 medical laboratories that are accredited as at today. Now, some of the labs that I got to learn have this accreditation. Probably you can correct me. I don't know whether all of them still have maintained this accreditation, or probably there are others that I didn't include. But I got to learn about the Greater Africa Accra Regional Hospital, the Eastern Regional Hospital, the Noguchi Memorial Institute for Medical Research, Lancet, the MDS Lancet in Ghana, and also the Kolebu Teaching Hospital. I don't know whether I pronounced that right. And also your National Public Health and Reference Laboratory. So out of the many, many laboratories that you have, within the country, this is just a representation of those that have been able to achieve that global and highly coveted mark of quality for ISO 15189 accreditation. Now, ISO 15189, now getting back to the standard, it is not a new document. It has been there for quite some time. Of course, before 2003, the year 2003, we were using other standards. So you'd see a medical laboratory getting accredited to 17025. But then there was a long process of ensuring that we now have a specific standard for medical laboratories. And that happened through the dedicated efforts of the CLSI, the Clinical Laboratory Standards Institute of the US, and they pushed ISO to come up with an international standard. I know you have heard about the CLSI's Quality Management System Essentials, the 12 Quality Management Essentials. And so, through the Quality Management System Essentials by CLSI and their experience with quality standards, they were able to convince, the stakeholders across the world to have a discussion with ISO so that we can have a medical laboratory specific standard that will guide how we do our testing. So that standard was first published in 2003, and that is why you will see 15189 22003, which was the first version. Now, all ISO standards are reviewed every 4 years. And so there was a review done in 2007 that resulted to a second edition. Another review was done in 2012 that gave us the third edition. There was another review done in 2015, 2016, but that review never resulted into any revision. And so we proceeded with that version of 2012 up until around 2021, when we got to review the standard again, which was finally revised and published in December of 2022. And that is the standard that we have been using since 2023, 2024, 2025, and now 2026. It is likely the standard could be reviewed again. Of course, it will be reviewed again, probably this year and, and also next year. But maybe or maybe not, the revision may or may not result into any revision. So we'll wait to hear from the stakeholders across the world and also ISO through the different accreditation bodies across the world to hear whether there will be any revision or we are going to continue with the 2022 version of 15189. And so this is our standard, ISO 15189, which is about medical laboratories requirements for quality and competence. Like I mentioned, it was published in 2022 in December, and it is our fourth edition. I don't know when our fifth edition will come out. It might come out very soon. But that will depend on whether many stakeholders will have any issues with the current standard version that we have. Now, this standard, I may not be able to go through the details of what it contains, but just to mention that it has five main clauses. And these clauses contains requirements for different aspects of laboratory testing. So, for instance, we have general requirements under clause 4, which talks mainly about impartiality, confidentiality, and patient rights in laboratory testing. We have clause 5, which talks about structural and governance requirements, which basically talks about issues about lab director, how the laboratory should be made legally identifiable, issues to do with objectives and policies, risk management, authorities and structures within the lab. And then we have clause 6, which is about resources. So it has requirements for different resources within the lab. And of course, one of the crucial resources in the lab is personnel. So this standard provides in clause 6.2 different requirements when it comes to personnel, from induction, training, and all that. There's process requirements, which then talks about the map of the laboratory activities from pre-examination, examination, post-examination, among other related activities. And then finally, when you look at clause 8, we have management system requirements, which are basically the documentation issues and establishment of quality management systems. Now, let me now go to the value very quickly of laboratory accreditation. Um, you may be asking yourselves, what is the need for us to go through this process? Now, for some of us who are in the private sector and who are probably trying to, establish their market, uh, accreditation to ISO 15189 is a crucial market differentiation and also competitive advantage provider for you because it sets you apart from those competitors who have not been able to, achieve these global standards. It is likely that your laboratory can be, a reference across the country, across the region where you're coming from, and also across the different countries that you neighbor with. And so accreditation, especially for those private sector laboratories, it serves you as a marketing asset because it provides you the signal for trust, quality, and consistency. And in fact, in some countries, many organizations, whether it is insurance bodies or research organizations, they'll want to work with a lab that is accredited. And so accreditation then becomes a pre-qualification criteria. Maybe for now, in Ghana, that we haven't reached there. But in the near future, because as laboratory professionals, you have to look into the future. It may be a crucial criteria for you to have engagements such as research and insurance schemes and such. So that's it's a market differentiator once you're able to achieve accreditation. It also increases your customer and stakeholder confidence. It's a mark of trust, it's a mark of credibility. So it demonstrates that you are objective, you're impartial. It also demonstrates your competence. Remember, the title for our standard is Medical Laboratories Requirements for Quality and Competence. So if you're able to achieve all the requirements indicated in that standard, then it will be a demonstration of competence. And so this gives an assurance that whatever you are doing is credible. It enhances your reputation among your patients, among your doctors, among other regulators across the donors and also the insurance providers who may insist that if you have to get some claims, then your laboratory has to show credibility in terms of having an accreditation. It may not have happened by now, but I believe in the future it will. So when stakeholders trust your lab, they are more likely to refer, to retain, and to recommend your services even to others. It also provides access to new markets and contracts. Whether you're a government lab or even a private lab or a research lab, accreditation status open doors for collaborations in terms of government and other donor-funded programs. It also ensures that you're
Okay,
able to
okay, okay, okay. Yes,
collaborate with
yes. We
other
are opposite. We
organizations.
are very opposite. I'm going to office. Yeah, yeah. So we follow him. Yes, he's going
Okay.
there. All right. So what am I going to tell him?
All right. Maybe Enoch, you can try to mute.
Oh, oh,
It
sorry
also
about that.
signals. Yes, Derek.
I was saying sorry about that. I've muted him, so we could go ahead.
All right. Thank you. Thank you. Thank you. So it also signals compliance with global standards and also allows your lab to collaborate well regionally and also internationally. For instance, if you want to engage in EQA and PT production, I know this is an area that many laboratories have not taken advantage of, that you're able to be an EQ provider for other laboratories, then a lab that has adhered to these global requirements is better placed, to be recommended as a site for production of EQA samples, as a referral testing center, or even collaborations in terms of research. Now, it also reduces the business risk in the sense that you are able to anticipate well ahead of time on what can go wrong and be able to work around the issues that are likely to go wrong before they actually happen. For instance, the 2012 version of this standard, it focuses a lot on risk-based thinking, and this then helps you to identify any vulnerabilities, any risks, or any uncertainties in terms of operation, finances, reputation, or other patient safety issues, so that you end up with fewer errors, fewer incidents, and fewer customer complaints, which then means a lower cost of reworking and such things. So proactive management of nonconformities also strengthens your business continuity as a private and also as a government and also research laboratory. It ensures improved operational efficiency and cost management because it forces clarity. With ISO, it is not about trial and error. Everything is well structured, everything has a way of how should be done. And so it forces clarity in terms of workflows and other procedures within the lab. So there is reduced duplication, wastage, and variability, leading to leaner operations and also lower costs per test. So you don't have to keep repeating tests because if you have the proper systems through accreditation, you must have IQCs, you must have EQAs, you must have appropriate measures to safeguard erroneous results. And so if you do the test once, you don't have to keep repeating to confirm because you already have the necessary measures to ensure that you are doing the right thing the first time. Now, continuous improvement mechanisms also provided by these standards, particularly on clause 8.6 and clause 5.6, then ensures that your laboratory is on an upward trajectory on improving itself. You don't have to wait for someone from outside to come and tell you. Being in accreditation and continuously implementing the standard, you're able to note and point out areas where you can do better and be on that upward trajectory of doing it right and ensuring efficiency and managing your costs in laboratory testing. Now, staff retention is another value that you get with 15189. Now, among the many labs that you have within Ghana, just a few of them have been able to achieve accreditation. And I want to believe everybody, wants to work in a place where there are systems. Everybody wants to work in a place where there are proper safeguards for you to deliver services that can be trusted by our clinicians and, other laboratory users. Because nothing brings down the confidence of a laboratory scientist than the user talking as if they don't trust the results that you have released. It brings the morale of a laboratory technologist very low. And so everybody would want to work in a place where everything is done in a structured way. And so they're able to be confident about the results that they release. So accredited labs often becomes employers of choice because staff gain the exposure through international quality practices and continuous learning. Structured competence assessments come with accreditation. And so there's also role clarity because ISO also ensures there's specific responsibilities given to everybody so that you don't have to keep changing roles every day. Every day you know what you need to do. And so ISO ensures that you have been given clarity in terms of your role. And what that does is to improve on your productivity and morale. So everybody would want to work in a place where they are better utilized, their confidence is built, and they're able to work with some proper morale. So staff pride in working in such organizations. And so that's why we are saying you're likely to have a staff retention. And for the staff on the other side, you have all these benefits in terms of enhancing your productivity and your morale as well. Now, it also strengthens your brand and reputation because accreditation, like we've said, is a powerful market differentiator which signals excellence. Any lab that has achieved accreditation will always pride themselves in delivering excellent services. And so this can be leveraged in all marketing proposals and other public communication materials. So on your website, on your official communication documentations, you can always cite that we are accredited. And with that accreditation, you're able to also attract, media visibility, academic collaborations, and also high-profile clients as well. We want to do much more than what we are doing now. We want everybody to recognize what we are doing. Now, the easy way to get recognized for what you're doing can be through accreditation, so that you're able to have someone, blow your trumpet. So that I know many times we do very nice procedures. We have all our processes lined up, but you don't have a voice, to say this is how much we are doing. People will not trust you alone. People will want to trust somebody else who comes and checks your system and says this laboratory we have confirmed they are competent, they are meeting all the international requirements for medical laboratory testing. And so accreditation is that tool that you need to strengthen your brand and also improve on your reputation as a laboratory. Financial sustainability, and this goes to everybody, whether you are a private lab or a government-owned laboratory. Every organization is looking for sustainability and growth. And that consistent and reliable quality is what will attract repeated business. Clients keep coming back and forth to seek services and also recommend your services to other users across. This consistency will also help us to gain the partnerships that are needed, especially where there are projects, where there are research work being done. So improved efficiency and fewer rejected claims, if you're talking about insurance schemes, then translates to better margins. You're able to receive better margins because you are able to safeguard your processes from any erroneous results or any erroneous documentation that might be rejected when you're submitting your claims for reimbursement. So accreditation also builds investor and donor confidence, then positioning your lab for expansion, franchise, and other joint ventures. And therefore, even though we say accreditation sometimes is a cost, of course, there's a cost to accreditation. But that cost, I want us to imagine it as an investment, not necessarily as a cost, not as an expense. It's an investment that you have placed. So the return that you get from that investment by far will outweigh the cost of that accreditation. So that is how accreditation can bring value to us. Now, let me briefly talk about the process of how to get to this accreditation. And I know my time is running out. Now, these are general process of how to get to accreditation, especially for a hospital and even for a lab, generally speaking. It begins from assigning responsibilities. Like I mentioned earlier, one of the crucial principles of quality management is leadership. And so by assigning the responsibilities for quality management to someone within the hospital, then it means we are on the right track to achieving the quality. So you have the quality manager, the quality officer, the quality champions, whatever name you give them. And then this team that you're going to assign these roles of quality management will help us to identify a guiding standard that you need. For instance, if you are looking for the entire hospital getting accredited, you can go for SafeCare, you can go for ISO 9001, you can go for ISO 7101, you can go for ISO 15189 if you are going specifically for the lab. You can talk about COSASA and other standards. Now, having identified the standard that will guide you in this journey, you will need to do a gap assessment so that you can know by how far are we from where we expected to be if you're headed to accreditation. So conducting a gap assessment against the standard that you have chosen. Then once you have identified the areas that needs to be addressed, you'll develop a quality management system so that all the processes within your lab, within your hospital, within your healthcare organization are addressed, within a structured framework of how things should be done within that laboratory. Then this team, definitely the quality champions, will then create awareness among everybody, within the organization of what is our procedures saying, what is our quality manual saying, what are our forms that will guide us in the implementation process, and then implement the documented QMS. And this is where this is now number 6, where we get it sometimes wrong. We document so much, we have very good procedures, but we take very little time to see whether these SOPs can actually be implemented. So it's good that you have a structured way of how you are going to systematically implement your SOPs. And then along the way, you need to continue monitoring whether these SOPs are being implemented properly. You can do competency assessments, you can do internal quality controls, you can do internal audits and all that, just to see whether your system is being implemented as documented in your quality management system document. And then once you confirm that the system is well implemented, you can now go ahead and apply for certification or accreditation. Now, for those who may have heard about the SLIPTA process, where usually guided by the ASLM, the African Society for Laboratory Medicine, they were doing something close to this, guiding you stepwise from the beginning to the end, just to see to it that you have been able to implement all the requirements before you get to applying for certification or accreditation. And then once you apply, you'll achieve it, but then you have more work even to sustain this certification and accreditation. And these are just some of the organizations that you can consider. But for the interest of today, we're talking about ISO 15189. Now, our approach, because I told you about that one of the services we offer is supporting organizations to get accredited. Now, we, as a company, we don't accredit. We can't accredit because accreditation the mandate is given to those accreditation bodies within the country or within your regional economic bloc. So ours is just a support so that we find when they are coming, they'll find the system ready for accreditation. So the first one, the process, ignore the heading there, is not the value, but the process of ISO 15189 accreditation. Our process begins from the foundation phase. Now, in the foundation phase, what we are talking about is coming to your site, your laboratory, doing a gap assessment, knowing how far you are from achieving the requirements. And once we do that, we're able to also prioritize some of the activities that we need to do. Probably it is, getting to know which trainings needs to be done, which infrastructural issues need to be sorted out, even as we proceed with other processes, which documentations need to be created, which equipment probably needs to be replaced, and all that. So that's under the foundation phase, trying to know what is how is the laboratory at the moment. Now, part of the foundation phase also includes trainings, and the training in this case is just to help the team that is working in the lab to know what are the requirements and how they can go ahead to implement them. So we do training such as ISO implementation, internal audit, risk management, method validation, verification, root cause analysis, corrections, corrective actions, and all those, and many others, depending on what gaps you are going to find in our gap assessment. That's the foundation phase. Gap assessment and training as capacity building. Number 2 is the documentation phase, because like we said, no system will be called a proper quality management system without a structured way of doing things. So we help the laboratory also to come up with the documentation that are needed, the manuals, the SOPs, the policies, the forms, and all that, and highlighting all the processes in terms of how each activity should be carried out within that laboratory. And usually we say, if you get it right at the documentation phase, you have achieved almost 30% of this process of accreditation. So documentation is such crucial because you're able to dictate, within your documentations how everything should be done, and that is how everybody will, what everybody will do, to ensure that you're able to deliver quality. Now, once the documentation is done, you can see we have three phases of implementation. That is initial, midline, and peak. Now, what happens in this phase is just to put these SOPs or these procedures into practice, but we do it in a very systematic manner so that we don't have confusion, so that we don't have look like we are burdening, the laboratory team, and also so that the organization can be able to provide the resources that are needed um, systematically without also overburdening the financial cash flow within the organization. So if we have prepared, let's say, 60 procedures, we have supported, the documentation of 60 procedures, we try to implement the first one third, the second one third, and the third one third of the documented procedures so that we're able to do it very systematically as we learn through the process. Now, some of the trainings I mentioned under the foundation phase, you see method verification, internal audit, and others. Sometimes we decide not to do them under the foundation phase and stagger them across the implementation phases so that we do one training within the initial implementation phase, another training in another phase, another training in the other phases, so that also we also don't give a lot of information within a short time. And then by the time we are getting to the peak implementation phase, we believe that your system is ready for accreditation. Of course, we'll do another internal audit just to see how far you have gone and make the application to your preferred accreditation bodies. So it can be GAS, it can be the West Africa accreditation system, and any other accreditation body, SANAS, that you will prefer. Then finally, once you have made the application and that accreditation body, says they are now coming for the accreditation, under the wrap-up phase, we help you to, do the final preparation towards the accreditation assessment. We support you also during the assessment. And finally, we also support you, in troubleshooting or doing or initiating corrective and also corrections and corrective actions for any identified gaps in the process. So usually this process can take from as low as 3 months to eternity, depending on how committed the organization and the laboratory staff are to this process. So that is briefly how we approach it, and we want to really welcome you. In case you have such a need, we'll be glad to support you and benefit from the value that you have been talking about for accreditation. So that is it from my end at this moment. I want to say thank you so much, but then just mention that in case you'd like to contact us on any of the services that you have mentioned, then feel free to contact our office line in Nairobi. You can also contact our representative in Ghana, Derek, through that number. And you can also contact me directly through the number that I have also shown. We are on all social and professional media sites. You can find us on X, you can find us on TikTok. We are there on Instagram, Facebook, LinkedIn, and also on YouTube. So feel free to engage with us, and we'll be very happy, to also have a discussion with you on any of the areas that we have talked about. Otherwise, thank you so much. Let me take it back to you, Derek, so that you can check for me if there are any questions, and I'll be happy to address them.
Thank you very much, Paul. That was truly an insightful session. We are grateful to you for your time. And so, as it stands, we don't really have any questions in the chat, but we'll open the floor for questions. Maybe 10 minutes for questions. So please, if you have any questions, you just show by hand. You'll be called so that you can ask your question. So I have one Prince Yabua. Prince, you can unmute and ask your question, sir.
Okay, thank you. It has really been insightful, like you mentioned. But I have a few of them to ask. So I want to know if this session recorded will be made available to us. And then, secondly, I'd also like to know if we would have certifications for this particular webinar. And then the third one, he mentioned something on software for QMS. How do we get access to something like that? And then the fourth one, can we also get access to PDFs of the ISO documents? So if it's ISO 15189, can we get a PDF of that document? If it's ISO 9001, can we get that document disseminated to us? Thank you.
All right. Thank you, Prince. I think, Derek, I can just go ahead and answer these ones. They are quite a
Yes,
handful.
yes.
Thank you. So, yes, indeed, we will share a recording of this probably in the course of the day. And then, in terms of the certification, for sure, we had not thought about it, but we will. I just noticed we have quite a number of people who have joined in. So we will prepare certifications for this webinar for all the participants who have been able to attend. And so we'll be able to get your names from the emails that you have used to register. So in case we misspell your name, we'll be asking you to probably help us to correct. Now for the software, uh, we are on the final stages of the development, because you have to do the development, do some pilot studies and all that, just to see how well your system is working. So probably in the next 2 months, this system should be ready for formal use. But for now, allow us to do the finish up. But after that, to be able to release the system. So Prince, maybe you can just type in your contacts. You can send to my colleague, and you can share with Derek as well, so that we're able to communicate with you once this system is ready. Now, the copy of the standard is available on the ISO website. You can be able to get it online. Of course, you have to pay, so you can check through the ISO website, but you can also check for that standard through your national standards body within Ghana, so that you're able to get it at the local rates, which are not probably as high as what you would get with the ISO on the ISO website. So that is it. I believe I've been able to answer. Is there any more questions?
Yeah, so Paul, we'll take a few. We have a few in the chat box. So one is asking now, what kind of accreditation is needed for an EQA or PT lab?
Okay, I can answer that direct. So
Yes.
for EQA and PT labs, they are required to get accredited to ISO 17043. ISO 17043, it is a standard that provides the requirements for any proficiency testing provider, either in medical laboratories, but also and also in testing and calibration laboratories.
Okay. Paul, we have another for you. It says, Is there a minimum qualification for the workforce in pursuing ISO 1589, or it boils down to pure competence?
Okay, so ISO is very silent on what are the minimum qualifications for the workforce. Um, but I mean, he's asking minimum. Is there a minimum qualification for the workforce in pursuing ISO 15189, or it boils down to pure competence? Okay, good. So first of all, ISO does not dictate the kind of competence that they require. What ISO standard will do, it will provide for us requirements, for staff, you have to get trained staff. You must specify the qualifications. You as a laboratory, you must verify your equipment. You must verify. So those are the competencies that ISO will specify. So whether it's a degree or a diploma or a higher diploma or a master's degree, that will depend on you as a laboratory. ISO does not dictate. But then whatever you specify in your procedures, it is what the assessors are going to use when they want to check your competence as a laboratory. Yes, Derek?
Yes, we have another. I'm coming. So there's one that says that to get accreditation, do we have to perform a lot of laboratory testings? Is it necessary to perform sophisticated laboratory testings to get the ISO 1589 accreditation?
Okay, maybe I can answer together with another one. Is there another one that I can answer together with?
Okay, so there's one that so there are two more. So let me take this. How much will be the cost for the mentorship, or is it free? Let me add one last one so you could take that in addition. So the question is that how can you integrate emotional intelligence into the QM principles? I believe that integrating emotional intelligence into our key QMS quality management principle within the ISO certification process will go a long way. Preparing staff in advance is essential as facility cultures and operations differ, and the process often leads to changes in operational structures. This approach ensures that staff are fully carried along while leadership effectively assigns roles and responsibilities. So those are the questions for you, Paul.
Okay, thank you. Thank you, Derek. A very interesting question there by Ebenezer Ofori. So let me start from the top. Let me begin with Prince Coffee, who is asking whether you need to do a lot of testing for you to pursue this process. Not at all. ISO does not say that you must be doing 50 tests in a day for you to get accredited. And so getting accredited is not in any way associated with the number of tests that you are doing. But now, of course, for you to achieve accreditation, there is also the costs involved. There's the cost of the accreditation body, there's the cost of EQA, there's the cost of internal quality controls, there's the cost of infrastructure, the cost of, service contracts for your equipment and all that. So ISO may not directly require you to do a number of tests to do accreditation, but for you to sustain also the costs that comes with accreditation, you require the numbers, you require the test, some numbers to be done within your laboratory. But now, what investors sometimes will do, they may not look at the laboratory in its current situation, because in your current situation, you may not be able to sustain accreditation. But investors will look at it in a different way. They look at it in terms of accreditation as an investment, or pursuing accreditation as an investment will help you in the long run to have more tests. So it may not bring more revenue at the beginning, but progressively, when you start communicating about the kind of services you're offering and these systems that you've been able to set up, you are able to align, to get more clients in that. So it does not have to be sophisticated. Labs have taken to accreditation simple tests like urinalysis, stool microscopy. So it doesn't have to be complicated, automated testing systems. It can be as simple as manual microscopy. and rapid kits that you can take to accreditation. So Abdul is asking whether, or in terms of how much the mentorship would cost, or whether it is free. So Abdul, it is not free, but the costs that we provide are quite subsidized. They're quite affordable. I may not be able to mention the exact amount because that will depend on what we will see in the gap assessment. But based on the information you give us about your lab, how many staff you have, the scope of your testing, we are able to then be able to tell you the exact cost. We're able to come up with a customized cost based on the scope of testing that you're having in your lab. I hope that will be answered well. So maybe, Derek, you can take note of Abdul, and maybe we can be able to discuss further after the session. Ebenezer, about your question on emotional intelligence and how it can be incorporated into quality management principles, definitely yes, because emotional intelligence it applies in all laboratory work, not even just lab, all healthcare work requires, like, for example, the leader to employ emotional intelligence, on the staff that they are leading. Now, the staff who are serving the personnel, who are serving the patients and other users, they also need to, understand them, where they are coming from, get into their shoes, and try to manage also their psychology. Being able to understand that this patient is looking just for assurance. They may probably not be very sick. They're probably just looking for an assurance that they will get well. And so I would like to say, when it comes to emotional intelligence, it is everywhere in your leadership. So when we say leadership, that's actually, you need to also have a way of incorporating emotional intelligence in leadership. When we say customer focus, when we are serving our clients, we need to understand where they are coming from. What are these troubles that they are going through? What is this need that they have? And so, yes, emotional intelligence should be incorporated. It may not be as at the moment, but I believe if you implement the principles of customer focus and leadership so well, then by that you'll be able to have implemented emotional intelligence. Thank you for that elaborate question. I think I have Prince asking a question again. Go ahead,
So,
Prince.
Paul. Hello,
Okay.
Paul. Hello, Prince.
Yes.
Just before you ask your question, Paul, we are reminded we have 7 minutes more, so we just be guided within the time frame. Thank you.
Okay. Thank you. Thank you. Yes, Prince,
Okay,
go
so
ahead.
I wanted to find out if this ISO process, accreditation process, would require that you would have to have certain specific analyzers with certain specific specifications. I want to find out, or you can just have some analyzers and then. Thank you.
Okay. Okay. Thank you. Thank you. Thank you, Prince. I can answer that directly. First of all, ISO standard is very silent, on which equipment models you need to have in place in your laboratory. It does not tell you that you must have this automated analyzer or this semi-automated or this. Yeah. So it is up to you now to know which equipment you want to buy. But whatever equipment you buy, you must consider clause 6.4 of the standard, which requires that we do acceptance testing for our equipment. And that acceptance testing has to involve verification as guided by clause 7.3. Because for every equipment we buy, for every testing method we have, we must confirm it is working well before we start using it. So ISO does not recommend one specific model, does not say we have to use this kind of equipment, but before whatever equipment you want to use, then has to be validated by the manufacturer so that you can come and do verification within your laboratory. Maybe that's what I can say directly. I saw another hand. Prince, you can finish up.
Hello.
Yes, Brian, you can go ahead.
Okay, my question, before you get accreditation, must you meet all the quality essentials, or there are some key ones you should meet before you are given accreditation?
Okay, so first of all, Brian, the quality management essentials as documented by CLSI, they are good. We used to use them, before we started these matters of accreditation. But for accreditation, really, when a gas or the West African accreditation system comes to assess your lab, they may not they may not assess you um, based on the quality management essentials. They will assess you based on ISO 15189. So that's what I can say. But when if we find, because assessments are actually sampling activities, they may not have assessed everything. They'll just tell you, you have been able to look at your system. In these areas, you are doing very well. In these other areas, you need to close a few gaps. Then we can come and, give you the accreditation. Most of accreditation bodies will give you 1 month to 3 months to close whatever gaps they find out in your system. Yeah, I'm advised that our system is almost closing, so I don't know whether we have just maybe one more, maybe Prince. I think this should be the last one. Yes, Prince, your hand is up.
Well, I think it was from before. I
Okay,
tried to
okay,
miss it.
okay.
Yes.
Thank you.
So there are no more questions for you, Paul. Thank you very much for your time and thank you for engaging us. And so, to everyone, we are grateful for making time to join today's program. Like we have mentioned, this is the first of a series of webinars that we'll be doing. And so, we believe that in the coming days, we'll expand more on the topic of ISO 15889, and most of the questions and concerns that you have may be addressed. But again, like Paul has shared, our contacts are there for you to reach out to us if you have any concern. You may reach out to me. I'll coordinate anything that you would have with Paul and all of and the team at Arancal, and then we'll get back to you. So thank you for making time. We believe that in the coming days when we do the other webinars, you'll be here to join us so we can discuss this all important topic of ISO 1518, I think 2022. Thank you very much and have a good day.
Okay, thank you, Derek. I want to wish you well. Have a blessed day until the next time. May God bless you, and let's continue doing well to our clients.
Thank you, Paul.
Okay.